Hey there. Ready to dive into something really interesting? You sent over some stuff about chest wall tumors, and honestly, at first I thought, well, this could be a little dry. But you know what? The more I got into it, the more fascinated I became.
Yeah, they are surprisingly interesting.
So, chest wall tumors, huh? Who knew they could be so fascinating?
Right. And, they're way more common than you might think.
Really?
Yeah. We'd be here for hours if I listed all the places they pop up. Bone, muscle, fat, you name it, they can show up there.
Wow. I never would have thought about it like that. I kind of just assumed it was like one thing in one place.
Nope. It's way more complex than that. And that's part of what makes them so interesting, right?
For sure. So, like, how do people even know they have these things? Like, do they just wake up one morning and bam, chest wall tumor?
Sometimes. Well, no, not
Yeah.
quite like that, but you'd be surprised. It's not always obvious.
Really? You'd think something growing in your chest wall would be, like, impossible to miss.
You'd think so, right? But they can be sneaky. Often the first clue is a lump.
Okay, that makes sense. But, like, a painful lump, right?
Sometimes it is, but sometimes it's painless. And that's where things can get tricky. People might not even realize anything is wrong.
Wow. So it could be easy to just ignore it?
Exactly. You might brush it off, think it's nothing serious. Or even if there is pain, it's easy to mistake it for something else entirely.
Right, like in that article you sent over, the woman who thought she just pulled a muscle.
Exactly. Turned out to be a chondroma.
Wow. See, that's what I mean. This stuff is way more interesting than I thought. So patient history plays a big role here, doesn't it?
Absolutely. It's like detective work, You got to look at the whole picture. Past injuries, infections, even things like radiation exposure, they can all be important clues.
So you're piecing together a puzzle, trying to figure out what led to this moment.
Exactly. And once there's a suspicion of a chest wall tumor, we bring in the big guns imaging techniques.
Right, I was going to ask about that. It seems like imaging is a key part of the process.
Absolutely. Think of it like needing to see inside the chest wall with incredible detail. That's where imaging comes in. X-rays are often the first step, a good starting point.
Okay, so you get a basic picture with an X-ray, but what if you need more detail?
Then we step it up. CT scans. They give us a much clearer picture of what's going on.
So we're talking like high definition now.
Exactly. Size of the tumor, the exact location, whether it's spread to nearby areas. CT scans tell us a lot. But sometimes we need to go even deeper.
Deeper. What's deeper than a CT scan?
MRI, that's the VIP pass to understanding a chest wall tumor.
Okay, so if CT scans are high definition, MRIs are like...
Think 3D IMAX.
Wow, okay, I'm getting the picture. So what makes MRI so special? Why the VIP treatment?
Because MRIs can do something amazing. They can tell the difference between different types of tissue.
So we're talking like muscle versus bone, that kind of thing?
Exactly. Muscle, nerves, blood vessels, MRIs can distinguish between them all. And that's crucial when you're dealing with an area as complex as the chest wall.
Right, you need to know exactly what you're dealing with. You mentioned spotting sneaky metastases. That sounds kind of ominous.
It can be. Metastases are like offshoots of the original tumor, and they can travel to other parts of the body.
Oh, wow. So not just in the chest wall anymore.
Exactly. That's why we use a special type of scan called a PET scan. Think of it like a detective, sniffing out any sneaky metastases that might be hiding.
So we've got the clues from the patient's history, the images from the scans, but the real confirmation comes from a biopsy, right?
You got it. Think of the biopsy as the gold standard for diagnosis.
The gold standard. No pressure there.
Right. But it's not just about confirming there's a tumor. It's about understanding its nature.
Okay, that makes sense. So it's like you see a lump, you know something is there, but you don't know what it's made of or how it behaves.
Precisely. And that's what we need the biopsy for.
Makes sense. Now, you mentioned different types of biopsies. There's more than one.
There are. And each one has its place.
Okay, like what? What are the options?
Well, there's the needle biopsy, which is like it sounds, using a needle to snag a sample of the tumor.
Sounds pretty straightforward.
Relatively, yes. It's often used for smaller tumors or if we need a quick way to get an initial diagnosis. Then there are excisional biopsies, which is when we remove the whole tumor.
The whole thing.
Yep. And that's usually preferred if the tumor is small and easy to get to.
Okay, so size matters when it comes to choosing a biopsy type. Makes sense. What about the location? Does that matter too?
Absolutely. For tumors that are trickier to reach, we might use an incisional biopsy. It's kind of middle ground that we make a small cut and remove just a piece of the tumor.
So like a sneak peek to see what we're dealing with.
Exactly. Now, here's what I find super interesting. The way the biopsy is done can actually impact potential surgery down the line.
Really? You're already thinking about the next steps, even at the biopsy stage.
Absolutely. It's like planning a road trip. You want to
Okay.
choose the route that will cause the least disruption and ensure the best possible outcome. The same principle applies to biopsies.
Makes sense. So it's all connected. You're not just looking at the biopsy in isolation.
Precisely. And once we have the diagnosis from the biopsy, that's when we can answer that all-important question.
Is it benign or malignant?
Exactly.
Okay, so let's break that down. Benign. That's the good news scenarios, right?
Usually, yes. But like most things in medicine, it's not always that simple.
Oh, no. What do you mean?
Well, even within the category of benign, there's a whole spectrum of behavior. Some benign tumors are totally harmless and never cause any problems. Others, well, they can be a little more.
Mischievous.
Exactly. They might grow slowly, or they might push on nearby structures and cause some discomfort.
So even benign doesn't always mean straightforward.
You got it. And that's why it's so important to understand the specific type of tumor we're dealing with.
Makes sense. So what are some of the usual suspects we see in the benign category? I remember you mentioning chondromas and how they can be a little tricky.
Chondromas, those are the ones that like to keep us on our toes. They can look very similar to their more worrisome counterparts, the chondrosarcomas, on imaging.
So even with those fancy scans, it can be hard to tell them apart.
Sometimes, yes. And because of that, doctors often recommend removing them, just to be on the safe side.
Better safe than sorry, right? Especially when it comes to something as important as your health. So chondromas, those are the tricky ones. What else you got?
Well, we have fibrous dysplasia, which is kind of like a bone that never quite grew up properly.
A bone that never grew up. What does that even mean?
It means that instead of developing into normal, healthy bone tissue, it ends up with this disorganized mix of fibrous tissue and bone.
So it's like the bone got stuck in its awkward teenage phase.
Something like that. And what's really interesting is that it's often linked to past injuries.
Whoa, really? So your bones hold on to those memories? That's wild.
Right. And then we have osteochondromas. They're the overachievers of the benign tumor world.
Overachievers how?
Well, for starters, they're the most common type of benign chest wall tumor.
So they're everywhere.
Pretty much. They're bony growths that stick out from the bone surface.
Sticking out, so they're like literally poking out.
Exactly. Sometimes they grow outward, which can cause a noticeable bump, but thankfully they're usually painless.
Okay, so a little bump is better than something more serious.
Definitely. But here's where it gets interesting. Sometimes they decide to grow inward.
Inward, like toward your organs.
Exactly. And that can be a problem,
Yeah.
but thankfully it's less common.
Dodged a bullet there. Okay, so we've got the chondromas, the fibrous dysplasia, the osteochondromas. Any other benign troublemakers we should know about?
Well, we can't forget about the desmoid tumors.
Desmoid tumors, what makes them stand out?
They're the rebels of the benign world. Remember how we said benign doesn't always mean straightforward?
Yeah, I'm starting to get that.
Well, desmoid tumors are a perfect example. They're technically benign, meaning they don't usually spread to other parts of the body, but they can be locally aggressive.
Locally aggressive, what does that mean?
It means they can grow into nearby structures, like muscles or even bones. They can be quite destructive, even though they're not technically cancerous.
So they're like the friendly giant who accidentally knocks over buildings because he's just so darn big?
That's a great way to put it. And that's what makes treating desmoid tumors so tricky. Surgery is always an option, but sometimes it's not the best approach.
Really?
Why
Why
not?
not? I mean, if it's causing problems, wouldn't you want to just take it out?
You would think so, right?
Yeah.
But here's the thing about desmoid tumors. Sometimes they just disappear.
Disappear, like poof, gone.
Well, not exactly poof,
Right.
but they can shrink or even vanish completely on their own. It's remarkable.
Wow. That's incredible. So how do you decide whether to operate or just wait and see?
That's where things get really interesting. And it's a decision that's made on a case-by-case basis.
So there's no easy answer.
Not always. And that's the thing about chest wall tumors. They keep us on our toes.
It's like these tumors have a mind of their own.
Okay, we've been talking about the less aggressive types. What about when things get more serious? Malignant chest wall tumors. Those are the ones that really make you stop and think, aren't they?
They definitely do. And it's true, understanding these types is absolutely crucial because they have the potential to be, really life-altering. So knowing what you're dealing with is so important for making the right decisions.
Right. You got to be informed to make those tough choices. So where do we even start? What are some of the big players in the malignant category?
Well, let's talk about chondrosarcoma. That's one you hear about a lot. It's actually the most common malignant chest wall tumor.
Really? So out of all the bad ones, that's the one that pops up most often.
It is. And it has a bit of a preference for certain spots.
Like where?
It's often found in the ribs and the breastbone.
Makes sense. Those are pretty prominent parts of the chest wall.
Hmm.
So what makes chondrosarcoma so tricky?
Well, it's a bit of a double whammy. On the one hand, it's slow growing. Okay, so that sounds like good news, right? Slow and steady, not a big deal.
You'd think so. But here's the catch. Even though it grows slowly, it has this knack for coming back, even after treatment.
Oh, wow. So even when you think it's gone, it can reappear.
Exactly. It highlights how important long-term vigilance is. Regular checkups, imaging, all that good stuff. We want to catch any recurrence as early as possible.
Early detection is key. That's
Yeah.
like with so many things in medicine, isn't it? Catching it early can make all the difference. Okay, so chondrosarcoma, that's one to watch out for. What else we got?
Let's see. You had highlighted Ewing's sarcoma family tumor, right?
ESFT? Yeah, that one was a mouthful. I definitely remember highlighting it.
It is a mouthful, but it's an important one to talk about because it tends to affect a specific age group.
Really? So it's more common in certain people.
It often affects young adults and even children.
Oh, wow. That's really tough. Kids dealing with something as serious as a chest wall tumor. That's heartbreaking.
It is. And it highlights the importance of having a multidisciplinary team involved in their care.
So not just one doctor, but a whole team of specialists.
Exactly. You might have oncologists, surgeons, radiologists, all working together to come up with the best possible treatment plan.
Makes sense. You want all hands on deck when it comes to something this complex. So ESFT, that's one where teamwork is essential. Now, you would also mention osteosarcoma. I remember reading about its link to Paget's disease. What's that all about?
Great question. You're right, there is a connection there. Osteosarcoma is a very aggressive type of tumor,
Aggressive meaning.
meaning it grows quickly and can spread rapidly.
Okay, so definitely not something you want to mess with.
Right. And the link to Paget's disease is one of the reasons why monitoring that condition so closely is crucial.
So if you have Paget's disease, you're at a higher risk for developing osteosarcoma.
Exactly. And that's why early detection is so important. If we can catch those cancerous changes early on, it can make a huge difference in terms of treatment outcomes.
It's like those connect the dots puzzles, isn't it? You see those patterns emerge and you start to understand why they're important. Okay, so osteosarcoma, that's one where early detection is paramount. What about plasmacytoma? That one sounded pretty unique.
Plasmacytoma is interesting because it often trips people up. It's often mistaken for something else.
Like what?
It's often mistaken for a solitary tumor.
Solitary meaning. Just one, all by itself.
Exactly. But here's the thing. It's not always as simple as it seems. Plasmacytoma can actually be a sign of a systemic disease.
Systemic, so it's affecting the whole body, not just one spot.
Got it. And it has a high chance of developing into something called multiple myeloma years down the line.
Multiple myeloma, that's...
Like type of blood cancer that affects the plasma cells.
Okay, so definitely not something you want to ignore.
Exactly. And that's why it's so important to look beyond the surface, to consider the bigger picture when we're dealing with these tumors.
Right, it's not just about what you see, it's about understanding the underlying cause and what it could lead to. Okay, so we've got chondrosarcoma, ESFT, osteosarcoma, plasmacytoma. Anything else I'm forgetting?
Well, we can't forget about the whole category of soft tissue sarcomas. That's a big one.
Soft tissue sarcomas, right. Those are the ones that involve soft tissues, muscles, tendons, that kind of thing, right?
Got it. Now, this group, it covers a wide range of tumors. And they're not all created equal, let me tell you.
Each one has its own personality.
You could say that. They each have their own unique characteristics and behaviors.
So, what are we talking about here? Give me some examples.
Well, there's one called undifferentiated pleomorphic sarcoma, or UPS. That one's a real toughie.
Why is that?
It's often resistant to chemotherapy, which can make treatment really challenging.
Oh, man. So if chemo doesn't work, what are the options?
Well, surgery is often the first line of defense, but it can be tricky depending on the location and size of the tumor. And then there's radiation therapy, which can be used to try to shrink the tumor or slow its growth. But yeah, it's definitely a challenging type to treat.
It sounds like you really have to tailor the approach for each patient based on their individual situation.
Absolutely. It's not a one-size-fits-all situation.
Sure.
Now, another soft tissue sarcoma you might come across is rhabdomyosarcoma.
Rhabdomyosarcoma. That's not one I've heard of before.
It's a rare one, thankfully.
Yeah.
But it really highlights the importance of having those advanced diagnostic techniques in our arsenal.
Right, like those immunocytochemical analyses you were talking about earlier.
Exactly. Those tools allow us to look for specific proteins in the cells, which can help us pinpoint the exact subtype of rhabdomyosarcoma we're dealing with.
And why is that important? What difference does it make what subtype it is?
It can make a big difference when it comes to treatment. Some subtypes respond better to certain therapies than others, so knowing what we're dealing with at that granular level can help us choose the most effective treatment strategy.
Makes sense. You want to target the enemy as precisely as possible. So we're talking about a highly personalized approach.
Precisely. And that brings us to another really important aspect of malignant chest wall tumor treatment. Reconstruction.
Reconstruction, right. Because sometimes it's not enough to just take the tumor out. You have to rebuild what was lost. And when you're talking about the chest wall, that's a pretty big deal.
It is a big deal. But thankfully, we've got some incredibly skilled surgeons who specialize in this area. Chest wall reconstruction has come a long way, and it's pretty amazing what they can accomplish these days.
So it's not just about removing the tumor anymore. It's about restoring function, making sure the chest wall is strong and stable again.
Exactly. It's about giving people back their quality of life. And that's where the art and science of surgery really shine.
It's mind-blowing, really, when you think about what surgeons can do. It's like they're taking these incredible complex puzzles and putting them back together piece by piece.
It's a very apt comparison. And just like with any good puzzle, you need the right pieces to make it work. That's where those prosthetic materials and muscle flap techniques come in.
Right. Those were the two main approaches you highlighted. Let's talk about the prosthetics first. What are some of the options out there these days? I know you mentioned Gore-Tex, which seems kind of wild, like the same stuff they use for raincoats.
Yep, the very same. It might seem strange, but Gore-Tex is actually a fantastic material for chest wall reconstruction.
Really? What makes it so special?
Well, for starters, it's incredibly durable. It can withstand the constant wear and tear of breathing and movement, which is essential for a part of the body that's always in motion.
Makes sense. You don't want something that's going to fall apart after a few rounds of deep breaths.
Exactly. Plus, Gore-Tex is biocompatible, meaning it plays well with the body. It doesn't trigger those nasty immune reactions that you sometimes see with other materials.
So it's like the body just accepts it as part of the crew?
Pretty much. It's not uncommon to see Gore-Tex patches used to bridge larger gaps in the chest wall, especially after a big tumor removal.
Okay, so Gore-Tex, that's one tool in the toolbox. What about those muscle flap techniques? Those sounded even more impressive, if that's even possible.
They are pretty remarkable. Imagine this. We can actually borrow muscle from other parts of the body.
Borrow? Like from a friend?
Well, more like from one part of the body to another, but not returning it. But in all seriousness, it's incredible. Surgeons can carefully detach a section of muscle, often from the back or the abdomen, while still keeping it attached to its blood supply.
Wait, so they're moving the muscle, but it's still got its own little lifeline?
Exactly. It's like a delicate game of connect the dots with blood vessels. The surgeon meticulously reconnects those vessels once the muscle flap is in its new home on the chest wall.
Wow, that is delicate work. So you're essentially transplanting living tissue from one part of the body to another.
Precisely. It's a testament to the ingenuity of surgeons and the incredible healing power of the human body.
It really is. So we've got the Gore-Tex patches for those larger gaps, and we've got the muscle flap techniques for those situations where you need to bring in some extra reinforcement. But how do you even decide which approach to take?
It's a team effort, really. Surgeons consider so many factors. The size and location of that missing piece of the chest wall, the patient's overall health, even their lifestyle and activity level.
So it's not a one-size-fits-all situation.
Definitely not. Every patient is unique, and their treatment plan should reflect that. Now, regardless of which reconstruction technique they choose, the surgeon's primary focus during the actual surgery, and this is key, is achieving those negative margins we talked about earlier.
Negative margins, right. That was the whole taking out the entire weed, roots and all analogy, right?
Exactly. We want to get rid of all traces of the tumor, create that safety zone around it, so we minimize the risk of it coming back.
So it's like you're drawing a line in the sand saying, tumor, you're not crossing this line.
I like that. That's a great way to put it. It's about being aggressive in the right way to give the patient the best possible chance of a full recovery.
Makes sense. So the surgery is complete, the tumor is gone, the chest wall is rebuilt. What happens next? What's the recovery process like?
Well, it definitely varies from person to person, and it depends on the extent of the surgery and the type of reconstruction that was done. But in general, we're talking about a significant recovery period.
Significant meaning? Weeks? Months?
It could be both, honestly. There will be pain management, physical therapy to regain strength and mobility, and of course, regular checkups to make sure everything is healing properly and to catch any potential issues early on.
Right, those follow-up appointments are crucial. You want to stay one step ahead of the game.
Exactly. And beyond the physical recovery, it's important to remember the emotional and psychological impact this whole experience can have on a person. Facing a cancer diagnosis and going through a major surgery, it's a lot to process.
Absolutely. It's like your whole world gets turned upside down.
Exactly. That's why having a strong support system is so important. Friends, family, support groups, therapy, whatever, helps the individual cope and heal, both physically and emotionally.
It's a reminder that we're not just treating bodies here. We're treating whole people with their own unique experiences and challenges.
Couldn't have said it better myself. Every single patient who walks through those doors is an individual with their own story and their own path to healing.
And that's something that's so important to remember, especially in medicine where it's easy to get caught up in the technical details and forget about the human side of things.
Absolutely. We can't forget about the human element. It's what drives us to keep searching for answers, to keep pushing the boundaries of what's possible.
Well said. Well, we've covered a lot of ground today, haven't we? From those sneaky, often hidden chest wall tumors to the incredible advancements in diagnosis and treatment, it's been quite a journey.
It has. And it's a journey that's far from over. There's still so much we're learning about these tumors every day.
That's the exciting part, isn't it? There's always more to discover, more to understand, and that's what keeps us coming back for more. So to everyone listening, remember, knowledge is power. The more you know about chest wall tumors, the better equipped you'll be to advocate for yourself or your loved ones. And hey, if you're ever feeling overwhelmed or unsure about something, don't hesitate to reach out to a healthcare professional. They're there to help guide you through the maze. Until next time, keep those brains buzzing and those questions coming.